morning. I am discussing about the current insights of diagnosis of management of the osteoarthritis. Osteoarthritis is a chronic and deliberated skeletal disease, and it is being the disability in elderly patients. The main cause are being the pain, loss of the function, and reduction in the quality of the life. Is more than 30% population in India. They are the knee pain is there, and globally there is the 300 million population is suffering from the osteoarthritis. Most common, the 31% are the women's obesity, elderly, and sedentary lifestyle. The risk factor contribute in development of the osteoarthritis. The risk factors are being the low muscular strengthening, inadequate physical activities, and wrong movement, occupation, history, existing joints pain, and fault joint alignment, and inadequate body and bone length. And the systematic risk are the diet. The predisposing factors means the advanced age, the non-modified risk factors, advanced age, mean gender, genetic, and the ethnicity. And systematic risk factors are the obesity and metabolic bone metabolism. The risk factor contributor in the fact qualified 9.6% are the men and the 18% are the women. The more than 60 years of age, they are the symptomatic osteoarthritis. 27% of the patients are less than 70 years of age, and 44% of patients are more than 80 years of age. The risk contributing development are being the age factors are there is less than 44 year age, 44 to 64, and the more than 65 years. Their percentage is being the gradually increasing day by day. The active limitations are the 50% of the populations are diagnosed with the osteoarthritis. Are the 52% of the risk factors is being on the hands, knee, and hip, the osteoarthritis. More than in the women's there is a more than 50% of the age versus the men. That means more the females are being suffering from the osteoarthritis. And there is a changes in the growth factor. There are changes and associated with in the gene methodology, the DNA methodology, and the histone modification, formation of microbial RNA. Risk factors are threefolds are in the obese patients, and threefolds are higher in the osteoarthritis of the knee joint are in the deficiency of the vitamin D and vitamin C. Even the patients with the diabetes and the hyperlipidemia. 12% of osteoarthritis cases are being traumatic in nature, and 80% are the osteoarthritis are of the ankle injuries are there, and 80% of sports persons are the previous injuries of the sports injuries. 80% of the evidence have the osteoarthritis after the age of 10 or the 30 years. The risk factor contributing the development of the osteoarthritis are being the maximum are the construction workers, forestry workers, farmer, and the military populations are the high risk of development of osteoarthritis. Availability association increase in use of the computer, laptops are being day by day is increasing with osteoarthritis. Pathological changes of the highlighting of osteoarthritis focus on the cartilage damage and loss. The cell and the modulator osteoarthritis role of the immunity. They cause the joint dysfunction are being there is a tissue damage of the joints and the rise to the multiple exhaustic muscles, multiple exhaustic molecules, and interpret pattern of recognizing receptors and PPR, the receptors associated with the innate immunity. Imbalance in the catabolic and anabolic pathology. Low grade inflammation over the cartilage, bone, and the synovium. Development of secondary compensatory are being the joint dysfunctions. Cell and the mediator of osteoarthritis are changes in the articular cartilage. They are under the normal condition, and some are the OA conditions. Extra-articular cartilage, in the normal condition, there is a matrix contain of the collagen and collagen 9 and collagen 12, and the proteogliadins and the chondrocytes are there. But there is a damage on the damage and the decrease in the collagen type 2 and increase in the collagen type 10 in the abnormal, and there is the cartilaginous degeneration is there. The interleukin and the tumor necrotic factors, the changes interleukin are being the interleukin 6, 8 and the tumor necrotic factors interleukin beta 1. The cell metallurgy is there. The changes of this, the key point are the bone, the calcification of the cartilage, subchondral bone plates and the trabecular bones supports overlying the cartilage and disturb in the mechanical load across the joint. In early OA, the subchondral bone loss is confirmed and comparative bone mineralization is there. Increase in the loading of the articular promote to the cartilage damage. Early detection of the osteoarthritis need and the method is there. 30% of the population is being the less than, and the maximum the patients are the more than 40 years of age. Especially in the women's, there is a severe loss of the cartilage volume and the entire joint. The quality of the life and high economic burning over an years. Early screening is being the important for the osteoarthritis quality of the life associated with the main the osteoarthritis in the patient is pain in the finger, hip and knee and ankle joint and more than 40 years of the age. And the significant increase with the ages. And the differential diagnosis is collagen vascular disease, gout, pseudo-gout, trauma, septic arthritis, ankylosing spondylosis and psoriatic arthritis. Diagnosis of osteoarthritis, the clinical features is being clinically we see the bone enlargement, functional limitations and pain during the flexions and the presentation of the Herbert's nodules in the interphalangeal joints. According to the American College of the Rheumatology, there are basically divided is the clinical division is there, the laboratory division is there and the radiological division is there. In the clinical, the patient complains with the pain, at least for the 3 or more features which correlate for the clinical findings. If the patient age is more than 50 years, stiffness is less than 30 minutes, there is a crepitus sound and the bone tenderness and bone enlargement and palpable warming means there is a swelling over the joint area. And clinical with the laboratory association is being the maximum the one and the same thing. The presentation of the knee with the stiffness, bone and enlargement and the laboratory finding is there in the ESR and the C-reactive protein has been raised. With the basis clinical with the radiological finding, we see for the pain complaint is there is osteophyte seen in the radiology and the below the 3 features we see is being compared with the more than 50 years of age, the stiffness and the crepitus is there in the clinical findings. Osteoarthritis in this the gold standard is being the plane image. If plane image means the X-ray we can find it out. The narrowing of the joint space and presence of the osteophytes and subchondral space there is cystic changes are there seen. Images, if we compare with the images, the MRI is the best, but 90% the cost effective, little bit costly to the compare to the plain imaging. In MRI, they are more than 50 years of age, obesity, non-obesity and asymptomatic. Correlation between the imaging and the clinical symptoms in number, 16% are being the frequently hip pain has been abnormal imaging seen and the 21% abnormal imaging find in the OA of the hip joint frequently pain. There is severity, it means calculated in the non-doubtful, minimal, moderate and severe. In the doubtful, we see the joint space is narrow. Patient on his diagram we see is the joint space is been increased, and in the minimum there is osteophyte sees on the X-ray, and a possibility of joint space is being narrow. In the moderate, there is osteophyte formation is there, narrowness of the joint space, and the Joint space, there is a sclerotic change. Sclerotic means there is a density seen over the joint space and the deformity in the bones end. The large severity, large osteophytes. Large osteophytes means extra growth we see, and the marked narrowing of the joints. And the severe sclerotic means that there on the scagramic density is seen in the bone ending. And the typical X-ray presentation means the AP view and the PA view are seen, and the lateral view are, but for the rule out the osteoarthritis, we in the standing X-ray is the important. Weight bearing X-ray should be done. A hip joint or the knee joint, weight bearing X-ray should be done. We compare with the plain X-ray with the limitations are there. The MRI, the plain X-ray is the low cost, and the MRI is the costly, and MRI is the sensitive, and the short term changes are saying gold standard is being the X-ray, and MRI is a explorer of the radiation. We protect the patient from the radiation. The MRI is being suited, and in the MRI, there is the soft tissue contrast and the accurate and the reliability there, but the limitations are there. That is the high cost and the limitation available. And the MRI is contraindicated to the implant. Implant means operated patient there is there. Knee only osteoarthritis, symptomatic osteoarthritis is being unilateral and the multiple joint, the osteoarthritis there, hip, hand and the spine. There are being the comorbidities, and the comorbidities are the presentation with the hypertension, diabetes, cardiovascular diseases, renal impairment, GI bleeding, depression, physical impairment means obesity. The progression of this osteoarthritis are the age, ethnicity and bone mass index, core morbidity count, and the infrasynovitis and the severity baseline on the radiological findings. Beyond the pain and before the surgery, the combinations are there, the non-pharmacological and the pharmacologicals are there. And the non-pharmacologicals are being with the self-management, then the education, weight reduction is there, exercise and application of walk with the sticks and the orthosols, in which the paracetamol is the first time and the long term can be used, and the topical application NSAID with the capsicum are the well tolerated. NSAID correlate with the partial, and the paracetamol therapy and the COX therapies are there. The opioids are being the partial use in the NSAID therapies, and the glucosamine, chondroitin, sulfate are symptomatic are the modified structures. Injectable are the intra-articular injections are there. The long-acting corticosteroids are there to reduce the pain and the effusion. For the non-pharmacological management, we tell the patient for the aquatic exercises and gait aid and self-management program. The widespread as being the aquatic exercises and the behavior and self-management. We guide the patient for the body exercises and the gait management. And NSAID are the risk factors are there with the NSAIDs are the GI side effects and cardiovascular complications are there. Pharmacological studies shows that there are being the cartilage in the matrix, their chondroitin sulfates are added, and the glucosamine is there, hyaluronic acid is there, cytokine moderator, diacerin combinations are there for the treatment of osteoarthritis. Cartilage management, these chondroitin sulfates which repairs the disc kinase and other nutrition supplements and delay the progression of the osteoarthritis and treat the destructive changes in the osteoarthritis. The combinations are there, different type of glucosamine, chondroitin and the placebo combination with the painkiller and diacerin combination, reduce the patient benefit. Choose of the therapies are there, And the analgesic there is that the GI bleeding is there, and myocardial infarction and chronic renal failure with the long-term use of the pharmacological treatment. Means the the COX-2 inhibitors are there, topical applications of the NSAIDs and the PPI therapy is there for the multiple joints and the comorbidities. Surgical management is there. There is the bone marrow stimulations are there, and the autologous chondroitin implantation is there. And the chondroitin transferase is being the main is the orthoscopically shaving is done, and the bone and cartilage grafting for the hyaline to replacement of undergoing to reduce, and graft dependable, and the grafts are available. Surgical management are the unicompartmental knee orthoplasty is, and total knee orthoplasty is there. Summary: the take-home message is being the high fold are in the elderly. The more are the patients. The take-home message is the more are the women's than compared to the men. Obesity is the high risk of the critical side effects are there. The main gold standard we go for the X-ray. The basic thing is the gold standard technique. The X-ray should be on the standing position, and the PA and AP view and the lateral view. And the nature, we see the nature of the joint space, and for the combination therapies are there, glucosamine and chondroitin for the matrix, and with the analgesic, and the non-pharmacological studies are there. NSAID therapies is there associated with the high rate of the morbidity, and the myocardial infarctions are common with the NSAIDs in the osteoarthritis patient. Thank you.